Hi, my name is Macy Linderhand. I'm a nursing student and I'm going to be demonstrating how to give a saline lock and then administer some medication through an IV push and finally discontinue an IV infusion. So to start, I'm going to list off my 6 medication administration rights, which is right patient, right medication, right route, right dose, right time, and right documentation. Then I'm going to perform hand hygiene. And then the next thing I'm going to do is obtain my order. So I have my order here from my provider for patient IV needed, has her medical record number. She has allergies to penicillin and latex. So I have an order for a saline IV lock at 2300, 327, which is today. So there's my first check with normal saline. Okay, so then my second check would be to obtain all my equipment, which is just a saline lock, alcohol swabs, more tape, and then check it one more time. Okay, so when I go into my patient's room, I'm going to introduce myself, and I'm going to perform hand hygiene, and I'm just going to explain to her that her provider has ordered a saline lock because she is now done with her infusion. So then I would grab clean gloves. So I'm going to ask her for her name and date of birth. IV needed 2298, and I would verify that is correct, and I would verify her wristband if it is needed by the hospital. Okay, I'm going to open up my normal saline. So I'm going to open it, I'm going to check the expiration date, and it is not expired, so I'm going to release this, take it off, get out any air, and then attach the connector, and then get any more air out. So that is ready, and then I'm going to access my patient's IV, and I'm going to clean where I want to go in. And I'm going to disconnect her line. Okay, and I'm going to hold and secure the IV with my non-dominant hand. And with my dominant hand, I'm going to get this saline lock on. And we're just going to flush with 5 mils of normal saline. Okay. I'm going to take the saline off. And I'm going to wipe it down one more time. If this hospital used them, I would put the cap on the end and leave it, and then assess around, make sure that the saline actually went into the vein and it didn't just pull around. So that would be just making sure that the IV is still in correctly, checking the site around for any redness, bleeding, anything like that. And my third check was with the patient's name and date of birth. And the next thing I'm going to do is just sign here and make note of any complications that may have occurred with the saline flush. Okay, so the next thing I'm going to do is we are going to be giving Dilaudid push. So I'm going to check my medication administration. It says to give 2 milligrams of Dilaudid IV push every 2 hours as needed for complaint, and the Dilaudid needs to be diluted into 2 milliliters of normal saline. So we're going to give Dilaudid 1 milligram every 2 minutes. So okay, so since the Dilaudid needs to be diluted in with 2 milliliters of normal saline, I'm going to have to draw up 6 milliliters of the medication to give 2 milliliters of Dilaudid. But I'm only going to administer 1 milligram every 2 minutes. So I'm going to first administer 3 milliliters and then wait a minute and then administer 3 more. So the first thing I'm going to do is just draw up my Dilaudid. So I'm going to clean it with an alcohol swab, and I would make sure to inspect this and check the expiration date. Okay, put on clean gloves. Okay, and like I said before, I'm going to draw up 6 milliliters. So this whole syringe. So I'm just putting 6 milliliters of air in. Okay, and I'm going to get the air bubbles out. Okay. And now I have 6 milliliters of Dilaudid. And I'm going to go back to my MAR, and this will be my second check that I have gotten the right amount. And then I'm going to grab my saline flush, and now I'm ready to go into the patient's room. So when I walk into the patient's room, I'm going to perform hand hygiene, and then I'm going to explain that she has a PRN order of Dilaudid for her pain when coughing, and that we're going to give that by an IV push. So I'll have her verify her name and date of birth, which is IV needed 2298, and that is correct. I'll scan her wristband, and that would be my third check for the medication administration. So then I'm going to put my gloves on, and I do have to flush with 5 mils of saline excuse me, before and after administering it. So with my saline flush, I'm going to check the expiration date. Looks good. Make sure there's no particulates. Pull on the seal. And I'm going to get all the air out. Okay. And then I'm going to get my medication close by. And then I'm going to wipe with an alcohol swab. If the hospital used the caps, I would just take that off since there's alcohol already in them. Okay, now I'm going to connect this to the saline lock and administer 5 mils. And my IV already has gauze underneath, but if there wasn't, I would put that underneath and then put another piece of tape around if I needed. Okay, so now we are going to go in and administer first 3 mils of Dilaudid. Okay, 3 mils is done. And then we're gonna wait. And this just ensures that it's going in correctly and that we're not putting too much in too fast. Okay, so after 2 minutes is up, we're gonna go in and give 3 more, because the order does say to give 2 milligrams every 2 hours and then 1 milligram every 2 minutes. So we're gonna disconnect that, connect my saline again, and flush another 5 mils. And then I'm going to wipe down the hub one more time and leave it. If it needs a new dressing, I would put that on. Looking for signs of phlebitis again. Is it hot, cold to the touch? Is there swelling, bleeding, anything like that?